Hello to all my friends and my colleagues. I'm Dr. Manvi Pankaj from Radiation Oncology in HCG Bangalore. I'm a first year resident and I'm here to tell you more about this subject. When I was an MBBS, even I did not know about this subject, and I'm sure most of you would be unaware about what is radiation oncology. So I'm here to tell you about this subject, and since counseling is on the cards and everybody is waiting with their ranks in their hands to just join a new branch and start their new chapter of life with post graduation, so I'm here to tell you that radiation oncology is also an option that you should go for, you should choose, and I'm sure you will love it. Since in MBBS we have no exposure to this branch, we do not know about this syllabus, we do not know about the opportunities that this branch has, so we tend to neglect this while counseling. But I'm sure after watching this video, you will have some idea about what this branch is. So first of all, let me clear that this is not radiology. This is radiation oncology or radiotherapy as we call it. It is a very futuristic branch. And why do I say that? Because even though it has a very rich past, it also has a very bright future ahead of it. Since you all know oncology is an ever evolving branch, is something new that we read every day. Some new drug comes, some new technique is devised, some new disease we start treating with radiation. So there's always scope for more. Got your NEET ranks. I'm sure those who got good ranks, or at least who are sure that they'll get their dream branch, congratulations to you and hats off, you've done it. You've achieved what you had to, and now you just have to take your branch, go forward with it. All the best. But for those who missed a little, they did not get the rank that they expected, and they're now in a dilemma. Will they get their dream branch, or will they have to look for more options? And I'm sure this video is for you only. You should definitely watch it till the end. So starting with oncology, what do you have to read about in this branch? This is technically a mixture of multiple branches, I would say. We can start with the anatomy of the cancer, go forward with etiology, pathogenesis, the pathology of the disease, then the natural history of the disease as we read in general medicine, along with the surgical aspect of the disease that is considered as surgical oncology, then going forward with the imaging techniques including the radiology, then nuclear medicine that includes all the radioactive isotopes and the scans we do in that, and newer techniques that are developing on the basis of genetics, on the basis of study of immunology. All this is included in the branch of radiation oncology. So there are three building blocks of this subject, starting with the anatomy, radiation physics, and radiobiology. So in anatomy, we have to learn about the basic anatomy of all the organs, cells, tissues, and all the organs of the body, since oncology is about the whole human body. And about that, we have to know about the staging of various cancers of the body. That is either AJCC staging or UICC staging. Second is radiation physics. Radiation physics is the study of energy transmitted from radiation, which is in the form of multiple kinds of rays like X-rays, gamma rays, positrons, proton rays, electron rays. And radiobiology is the interaction of radiation with matter. How radiation affects different cells, tissues, and organs of the body, how it makes changes in the DNA of the cells, how it affects normal cells, how it affects cancer cells, and how we can use this radiation to treat cancer. These are the basics of radiation oncology that we have to know before we deep dive into the world of oncology and unravel its secrets. This is in the first year of residency. In the second and third year, we focus more on different cancers of the body. In that, we have to know about the management of cancer, the prevention of cancer, various cancer registries, palliative care. In the management of cancer, we mostly have three broad categories of treatment: surgical, medical, and radiation. we have to know a little about all of the aspects of oncology. We have to be a jack of all to master the subject of oncology, and a lot better if you can master all of these subjects. So surgical aspect, we have to know breast, we go for breast conservation surgery and various other surgeries. Second, we come to the medical aspect, which includes all the chemotherapies, immunotherapies, targeted therapy, biotherapy, gene therapy. So we have to know in detail about all of these therapies that are available, for which all cancers we can use them, and for which cancer, which drug exactly has to be given. And third, most important, is radiotherapy. In that we have to know about the different techniques of radiation, the different rays of radiation that we can give, the different cancers we can treat, the different benign conditions that we can treat with radiotherapy. And it is a very interesting branch if you want to know more about it. So now, most important question, why should you take this branch? As a specialist, you will be working what all medical oncologists do. You're studying and practicing what all super specialist medical oncologists do. If not, then you can also go for super specialty, that is medical oncology after this. Another way of coming to medical oncology is through internal medicine, but since we know internal medicine is a very demanding branch in terms of rank, so if you've not got the rank that it demands, either you take a drop or you can join radiation oncology and then go into medical oncology. But as we know, every branch has its positives and its negatives, so you must know both of them before you take this branch. Now, as you remember, I said that this is a very futuristic branch. So why did I say that? Futuristic because it is ever evolving, because there is always scope of research, there's scope for knowing more things, there's scope of newer techniques to be developed in future. And if not the whole world of oncology, you can specialize in one organ or in one technique of radiation or in one domain, like either chemo, immuno, or you can just go for research. And the best part is that this branch will always keep you on your toes. You will keep your ears open and your eyes open wide, so that every time a patient comes back to you, you will be always ready with a newer technique, a newer treatment, and a newer hope for future. So I hope some of you have been motivated to at least consider this branch, and at least you have an idea about what this branch is. So if you have any more doubts, you can comment and I will be happy to answer all your questions. Thank you.